Welcome back. Yes, you read the title right. The health insurance premium are going to increase for 2019 from 1st of August. This is not any April Fool's joke. Probably already aware of it. If not, now you are aware of it. And this video is about giving you a bit of an understanding about how much that is, and in this video I will also focus a little bit more into the background of on what basis these the limits are increasing. It's also valid for the blocked account. I didn't cover this in the previous video as it was too much in one video, but in this video I'm going to give you the more background information. Before we begin, there is an act in Germany, so that's the BAföG. It's the Bundesausbildungsförderungsgesetz. Welcome to Germany. In English, the German Federal Training Assistance Act. I repeat, it's the German Federal Training Assistance Act, but all over you will hear it as BAföG. So I will give the link to the BAföG site and the description, so you can spend the night trying to understand what they do. But in a summary, so what they do is the act is basically there to support young students and young people in Germany to get into to help them with their further trainings, so education and so on. And this act basically give a grant to the students. So in terms of scholarship, partly like interest-free loans. And they every year, if not once in a while, they have to define how much the grant should be. So BAföG basically defines, the living expenses for the insurance and this and that, and total a student need, let's say 720 euros. Probably now you see from where the 720 euros for the blocked account is coming. Basically BAföG defines how much a student needs an year for a specific year. And so this will be used as a kind of like derived value for the other things like the blocked account and also for the health insurance. So basically the health insurance premium for the students, when I say health insurance, it's the German public health insurance. The premium for the German public health insurance is calculated on the basis of the BAföG grant. And as this has been increased for the next year, that is for the 2019, for the winter semester, the health insurance premiums are also increasing. So it's basically a calculation of 10.22% of the grant. So the grant is increased to 744 euros, and the reason on top, they have like 109 euros as a support for the health insurance. So in total it's 853, but for the health insurance there is an increase. This year the increase is quite strong, I feel. So currently the health insurance premium is around 92 euros, 91, 93, depends on your situation, if you are married, if you are with children, without children. And this will be increased to like more around 10 euro. So in the range it will be around 102, 3 euros till can go up to 108, 9 euros. Yes, it's for one side of the students, it's a good news. If a student lives here in Germany and as a German European student, if they get this BAföG grant, so they get a bit more money on their hands going forward from August or September. But on the other side, it actually affects the non-European students coming to Germany, because the blocked account is based on the BAföG grant and the health insurance based on the BAföG grant. So basically, compared to the last year or the current year, the future winter semester students will have to have 100 euros more, 120 euros more in the blocked account, and they will be paying around 10 euros a month more towards the health insurance. Yes, I will also give a couple of links in the description that will be useful for you to a bit of an understand what BAföG is and how these things are going, and all the calculations what I explained. Maybe I'm not sure if I mentioned the percentage very correctly. I will give the description. If not, I will make a post in our Facebook group where a lot of students are discussing and proposing new topics for me to discuss. If you have not joined, also I will give the link to the group in the description to join, and then you can also interact with me there in the group. And I hope this helped you. And yeah, take care and see you in the next video. Bye bye.